right. Hello, guys. My name is Christian. Her name is Maddie. We are nursing students from LCC Lassen College. We're here today to talk to you guys about the use and abuse of nicotine. In this presentation, we're going to talk to you guys about the history of nicotine, the effects on the many body systems of nicotine. We're also going to talk about some cessation techniques you could use and some other cessation techniques you could use with others. And again, some resources you can use if you have more questions. All right. Before we delve into the history, I'd like to ask you guys a question. Do any of you guys have an idea of the plant where nicotine derives from? Or any geographical region where nicotine's indigenous to? All right, nobody? So, nicotine is derived from the plant called Nicotiana tabacum. And that plant is native to North and South America. It was widely used in Mesoamerican civilizations by the Mayans, and Mesoamerica is in current-day Mexico and Central America. The Mayans used it a lot in their ceremonial and rituals, as they believed it had medicinal purposes as well, as it could help the soul. And archaeological findings have told us that it was used as early as 1 BC in pre-Columbian America. It would be so popular in pre-Columbian America that it would spread north towards the Mississippi Valley people, which is in present-day central North America, where it was used again heavily in a very similar methods as the Mesoamericans for ceremonial and ritual purposes. And archaeological findings tell us that it was used from about 470 to 630 AD. Eventually, it would spread down to the Caribbean, which is east of Mesoamerica, where, if you remember history, Christopher Columbus and his men would land right in where today is the Bahamas, and he would meet natives who had a very different culture and didn't have any metal weapons and dressed very different from how Europeans were. Another thing that the natives showed to Columbus and his men was the nicotine plant, and they even invited him into one of their rituals to use it. Well, the plant would be so foreign to Columbus and his men that in Europe, they didn't have anything similar to it, as everything in Europe mostly was drank, like alcohol and potions, and anything else that could alter the state of mind. So Columbus and his men described the natives kind of like drinking the air of the tobacco smoke, because they had nothing they could compare it to. And this is obviously very different, as it is an inhalation of smoke. And Columbus would eventually bring this to the monarch of Spain so that they could test it. And when first presented it, they kind of did have a bad opinion on it visually, as some described it looking like a piece of feces. It's just a long brown branch. Some thought it was just a stick. However, when it was inhaled, they liked it due to the calming properties of the drug, and this was what would trick people into believing that it could be used for medical purposes. Eventually, it would really reach its stardom when the Queen of France would receive it from her own foreign explorers. And she said that it cured her headaches, and she recommended it for others, and it was widely used by the aristocracy in Europe at the time, as they were the only ones who could afford foreign products in the colonies. And again, the drug would expand with European colonialism that was taking root at the time, as it would reach Japan and East Asia via the Spanish and the Portuguese, and eventually be so popular in Japan that the Japanese would come up with their own pipe, and they called it the kiseru, that they would smoke out of, and it would spread to Africa on the coast, where it was again grown a lot on the coast, which is why there's so many port cities in Africa. And eventually it'd have the biggest effect on the eastern seaboard of the current day US, where it's grown as a cash crop, as many plantations were made where forced labor was used, as people eventually started using it as a pleasure instead of like a medicinal, as again, the calming property tricked people. So they kind of used it like how they use alcohol or beer today. And again, that is what would lead to the population boom in the 1700s in America, and why colonies like Virginia, the Carolinas, and Georgia were richer than the northern colonies like New York and New Jersey, because of that and all the money that was involved. And also South America, as tobacco plantations were very, very big down there. Eventually, around about 100 years later, a German scientist would be able to separate nicotine from tobacco and create the cigarettes we know today, which again was able to prosper off the Industrial Revolution, which was happening, which allowed for more people to smoke. Because if you remember economics, the more of something, the less it costs. So that meant even poor people could smoke as much as they wanted to. And again, with all this money on the table, many companies thought of new and intuitive ways to try to make people ingest more nicotine. So they thought of different routes and different products. And some of these products included vapes, patches, pouches, lozenge, inhalations, and even nicotine gum. And with all this use, eventually the evidence started to amount that showed how bad the products were. People started suffering from bad teeth, bad respirations, and however, it still confused people as the population. It wasn't really talked about like how it is today. There was no centralization of it, really. So that is why even today, the public at large still doesn't know too well why smoking is bad. And that's why hopefully today we'll clear up any mishaps and any questions you have, and we'll talk about the effects smoking has on the body systems.
All right, so speaking of the body system, does anyone know exactly how many systems in the body are affected by nicotine? No one? Okay, so I will tell you. So a whopping 6 out of 11 body systems are actually affected. The systems that are affected are the cardiovascular, the muscular, the respiratory, the central nervous system, the digestive system, and even the reproduction system in males and females. So starting off with the cardiovascular system, there is increased risk for clotting, increased or decreased heart rates, and what's called coronary artery constriction. Does anyone know what that is? Nope. So the coronary arteries actually feed the heart its blood, and so that's what keeps it pumping nice and strong. And so the constriction is the when the vessels get smaller. And that's where the increased risk of clotting comes from, because when those vessels get smaller, things get stuck in them more easily. Moving on to the muscular system, there is like tremor and leg pain. And then in the respiratory system, you get what's called like bronchospasm, as well as coughing and wheezing. And you get permanent air damage to the lungs, which is like often where you hear like that popcorn lung, as well as many different types of cancers. Obviously there's like mouth cancer, there's throat cancer, there's stomach cancer, there's lung cancer, colon cancer, etc., just to name a few. And then moving on to the central nervous system, these are the most like commonly seen side effects, with that lightheadedness and dizziness, and then also that irritability and like some sleep disturbances. And then going on to the digestive system. So then we get like cotton, or like what's called like dry mouth. And then we also get like loss or decay of teeth, as you can see in this picture right here, as well as just like bad breath and everything. And then we get like nausea, vomiting, loss of appetite, and even like diarrhea, as well as like heartburn. And then going into the reproductive system, we have, so women get menstrual irregularities and decreased infertility, and males get with like low sperm count, as well as erectile dysfunction. And so then these are just a couple pictures, like I was mentioning, that coronary artery restriction, the teeth, picture of like a man coughing, that leg pain, and then a picture of like a healthy lung compared to a very damaged lung. And then before looking at the picture, does anyone know what percentage of kids smoke? So it's estimated about 1 in 4 kids, so about 25%. And then 85% of those kids who are smoking are using flavored nicotine products. And so we are going to watch just a quick video about nicotine versus like smoking and like some of the newer effects that are popping up.
And new research is shedding light on the health risks of e-cigarettes. The American Heart Association finds vaping may have long-term impacts on a user's heart and lungs, despite being marketed as an alternative to help you cut back on smoking. After looking at more than 300 research papers focused on vaping and e-cigarettes, doctors found the chemicals may hurt your heart, lungs, brain, blood vessels, gastrointestinal system, and other parts of your body. The AHA says more research is needed. ABC News contributor Dr. Alok Patel joins me now to break this all down for us. Dr. Patel, thanks for coming on. What does this study actually say about the impact of vaping on people's bodies?
Well, Dan, what this study is adding to is a large body of other studies saying that there are some known risks when you are inhaling things like these volatile organic compounds, heavy metals, flavorants, and the high doses of nicotine. And there's a lot we don't know. Now, we've been reporting for years about the direct effects on lungs and what nicotine can do to the body, but all these other chemicals can affect a lot of our organs, from our heart to our lungs to our immune system. And it's especially concerning in young people. If you look at 2017 to 2019, use doubled amongst young adolescents. And I will tell you anecdotally, I have a lot of teen patients who vape all the time. So it's really important that we put out these statements looking at vaping on its own and not just the marketing tool saying that it is quote unquote an alternative to cigarettes. We need to independently look at it and its long-term risk factors.
Now, vaping is often thought of as a safer alternative to smoking cigarettes. Is it?
You know, it's really difficult to make that one-to-one comparison, and the vaping industry does put that out. Now, I would say to anyone out there who's an adult and wants to try this as a way to quit cigarettes, it's important to talk to a health professional and find the option that's right for you. But Diane, the big issue is that this marketing, especially as it's directed to teens, has led some people to believe that, hey, vaping is not that harmful. We simply know that, number one, that's not true. It's associated with a lot of different illnesses, and we don't have enough data, long-term data, to talk about what it could do with respect to cancer and other chronic illness.
And there are, I know, a lot of chemicals in a lot of these e-cigarettes and other vaping issues, but some of them also have more nicotine than regular cigarettes. Critics also say some of those vaping flavors make them more enticing, especially to kids and teens. So how hard is it to quit if you decide that's what you want to do? And what can people do if they're struggling to stop vaping?
It's incredibly difficult to quit, especially with those high levels of nicotine. And as you mentioned, the way these cartridges are designed to have those flavors and to feel a little bit smoother so they're not rougher, we see teens who are vaping continuously, who carry the pens with them and really don't feel any of the harsh effects because it's quote unquote smoother than a regular cigarette. People should look at vaping exactly as an addictive, dangerous tool and seek help if they're having trouble getting off of one. And this involves parents getting involved in the conversation, making sure they're having a judgment-free, open conversation with their teens and saying like, hey, here are the realities. But I'm talking a lot about teens, even an adult who are vaping a lot, they need to really look at it and say, this is not necessarily a safer alternative to cigarettes. This may be something that they need to quit as well, and that we need to have a broader conversation about with respect to smoke-free legislation and public health initiatives.
So important. Dr. Patel, great to have you here. Thank you.
Thank you.
All right.
Hi, everyone.
Oh. Okay. And so now we are going to go over some of those cessation or quitting techniques. So everyone got a pamphlet that we passed out. So we are going to be talking about the inside of the pamphlet right now. So first off, starting with making a quitting plan. So picking a date to quit is very important. It gives yourself like kind of a timeline, letting you know when exactly to wean yourself off, and just how that can look for you, making it personal. And then moving on, identifying when and why you're smoking. Most people have they use smoking when they get really anxious or when they have like mental health issues going on. That is not the best solution. So identifying when and trying to replace those habits with things that are better can help you with making that quitting plan, like just helping you stop. And then moving on to asking for help. So asking for help because quitting is hard. And it's hard to go through it alone. And that's why it's like when you have someone to encourage you, it just makes it a lot easier. And they can also help you with identifying when you're smoking and like what else you can do to help instead. And then we also have like making an agreement with yourself. So like, for example, if you smoke 10 cigarettes a day, or if you're vaping a lot during the day, maybe trying to like cut that back to like, oh, I won't smoke now, I'll smoke later. Or even like going down from like that 10 cigarettes to 5 cigarettes, and then just trying to cut yourself and wean yourself off of it as much as possible. And then moving on to some tips for quitting. So like the first tip that we have is just thinking about all the ways that your life will improve when you quit smoking. Like when you'll smell better, and then also you'll get like a sense of taste back. Like what smoking does is like when you inhale it, like all those chemicals cover your mouth. And so it actually decreases like your sense of taste. And then like after you quit, you won't be as like anxious. You won't get those withdrawal symptoms and you'll naturally feel better because you're not always thinking about smoking. And then moving on, like, so getting rid of any temptations that you might have, like any old cigarettes lying around or any old like vape products, like the little like bars and stuff like that, as well as just carrying like sugar-free candies or like lozenges to help distract your mind and your mouth, like keep it busy. So like instead of smoking, eating one of those, and then like diet and exercise, as well as like avoiding alcohol. One of the main benefits of quitting smoking is that you're helping your body. And when you add a new bad habit like drinking, then you're just hurting your body in a million different other ways. So, and then we also have on here managing withdrawal symptoms. So drinking water, obviously, diet and exercise. Exercise naturally releases like endorphins that like make you feel better, so that'll help. As well as, like I said, like eating those lozenges or like candies, just to keep your mind busy. And then moving on to the back of the pamphlet, we do have Quitline services. So we have a couple call options. So the first one being it's the Suicide and Crisis Lifeline. So that one is going to be 988. And they can just help you if you're going through a really hard mental time because you're stopping smoking or you're getting to that point where you need help. And then we also have the Quit Now option. So that number is 1-800-784-8669. And that'll help connect you to a Quitline coach who can make that plan for you or help you stick to it. And keeping everything confidential. We know that sometimes it's hard to let someone else know. So having this Quitline coach to help you and keep everything secret is good. And then we also have a text option. So you just text Quit Now to number 333-888. And that'll connect you to it's the same thing as the number. It's just through texting, which might be a little bit more convenient for all of you. And then we also have the last category is medications that help cessation of smoking. So we obviously have all the nicotine products like the patches, the lozenges, the gum, oral inhaler, and a nasal spray. But there are also a couple of prescriptions that we have included. The first one being varenicline, and then the second one being bupropion. Those both do need a prescription, and that is a conversation that you have to have with your healthcare provider. Again, it goes with that making that smoking plan. The medications are a last resort just because maybe the withdrawal symptoms are too strong or maybe nothing else is working. That is a personal decision for you and your healthcare provider. We would recommend just trying to stop on your own, but those options are there if needed. So after today, like we hope that you guys understand the importance of why to quit smoking and like how harmful it is for your body and to not replace it with another bad habit like drinking. And that help is there and that we have provided you with a couple of numbers, a couple like a text option, and there are so many more resources out there. We've just provided you with some free ones. And then also like if you have a friend who needs to stop smoking, that we have extra pamphlets for you to take to them. Because it is dangerous. And one last thing we wanted to share with you guys today, it is what can happen if you don't stop smoking. Like you or anyone else, it can happen to anyone. And we just wanted to show you this video because it is tips from a previous smoker. So we'll click that. Oh, 1 second. Oh, this thing is just not wanting to work right now. There we go.
I had my first cigarette at age 13, and at age 17 is when I really started smoking on a regular basis. And then in 2000 is when I found the little sore on the inside of my mouth, and it wouldn't go away. And on a routine dentist appointment, he saw it and he thought it looked suspicious. So he did a biopsy. Well, it came back as mouth cancer. So I had to go through radiation. And then in December is when we discovered the tumor in my larynx. the day of my surgery, I can remember smoking up to the front door of the hospital. That's how addicted I was. And I didn't know that I was so addicted until after I got out of the hospital. When I went home, I went straight. I went straight to my bedroom, picked up a cigarette, put it in my mouth, and lit it. And for the first time, I really looked at myself in a mirror. And I thought, Terry, what are you doing? You have a hole in your neck, and you're getting ready to use what did it to you. My advice to somebody who doesn't smoke, don't ever start. My advice to those who do smoke, please quit, or at least try.
Alright. Did anyone have any questions for us? Any comments?
All right. If you don't have any questions now, just always know that you can always go to a local clinical center if you have any more questions, or online, obviously. But if you want to see us again, you just have to go by the campus and just let them know.
Or even the teachers on this campus can help as well. If you just need someone to talk to, I know that you guys have counselors. Just reaching out to someone, making that first step is very important. But have a great rest of your day.